for today?
A physical.
Alright, now, before I start anything, I'm going to wash my hands with soap and water. Typically, you can sing in your head like happy birthday to make sure that you're washing your hands long enough. And you want to scrub hard enough, even under your fingernails, to get the dirt and bacteria out. So maybe should be set. Alright, now just take off your shoes for me and let me take your height and weight. Step on the scale. You're 120. Now I'm going to lift the up, turn around. Okay, 5 foot. I'm just doing this to make sure that you're growing properly, and it seems like you are. You're the same weight you were. So I'm going to take your temperature, so I want you to stick this under your tongue and wait for the reading. So your temperature is 98.6. That is normal, and that would also be 37 degrees Celsius. So when I took your temperature, I instructed you to put it under your tongue, and because there's a lot of rich arteries under there, and those arteries help indicate your internal core temperature. If your temperature was high, that would indicate that your body is fighting off an infection, releasing the pyrogens, which are a heat releaser, and those help kill the bacteria. But your temperature was normal with the. So I'm going to check your pulse. I'm going to use your radial pulse, and we're going to do this for 30 seconds. Okay, so your pulse was 33 and 30 seconds, so your pulse is 66 beats per minute, which is normal. The normal range is supposed to be from 60 to 100 beats per minute. The force of your pulse, I would rate it a 2+, which is normal. And the elasticity of your veins, they're normal as well. They're very elastic. Sometimes as you get older, they get hard. And the rhythm was regular. I didn't notice any irregular rhythm with your pulse. So I took your pulse because every time that your heart beats, blood is ejected out of the aorta and it goes to your arteries, and that force is felt in your arteries from the force of the aorta, the blood coming out, and it's going all into your arteries. And I did that because I'm looking for palpitations and your heart rate, because sometimes heart rates can be a little slow, which could indicate if you're an athlete or other causes. And fast heart rate could indicate hypertension and other cardiac problems. Alright, so while I was assessing your pulse, I also was assessing your respiratory rate, and I took the number I got, which was 6, and I doubled it by 2, which your breath rates were 12 breaths per minute, which is normal for an adult your age. So I'm going to check your lungs for symmetrical chest expansion. So take a deep breath. And turn around. Take a deep breath. Okay. Yours was normal. If they were not normal, it would indicate a pneumothorax, which is a collapsed lung, but yours were within normal limits, and my hands equally went up and down as you took your deep breath in and out. So while I was assessing you, I noted that your patient position while your breathing was within normal limits, and by that, because you weren't struggling for air, you're able to breathe with your arms by your side or on your lap, and that's within normal limits of your positioning for. So when I was assessing your respiration rates, I didn't tell you that I was doing that because sometimes it indicates you get self-conscious about your breath and you don't breathe how you would normally breathe. But if your breath rates happen to be high, that could indicate like anxiety or after you just exercised, but your breath rates are within normal limits. So I'm going to take your blood pressure. I'm going to use the adult cuff for your average adult sized arms. And I'm going to use the diaphragm of my stethoscope to measure. So I'm putting this side against the limb. And I'm putting it 2.5 centimeters above the brachial artery. And I want you to sit up straight and keep your leg uncrossed and keep your arm at this length by your heart, the same level as your heart. And I'm looking for your pulse. I'm going to use your radial pulse again. And I'm going to cut it off or I'm going to inflate this until I don't feel your pulse anymore. And I'm putting the diaphragm of my stethoscope underneath her brachial artery, underneath the cuff. So your blood pressure read to be about 110/60. That's within normal limits. The golden standard for blood pressure is 120/80. But yours was a little bit low, but that's within normal limits. Assessing your blood pressure, I was looking to see if your blood pressure was either high or low. Yours was a little bit on the low side. Low blood pressure could indicate orthostatic hypotension. And what that is when your blood pressure is low, it's not circulating as well. So you could have problems when you'd stand up, you would get dizzy, or like hot temperatures could cause that dizziness feeling. If you had high blood pressure, that is also known as hypertension, and that would indicate like other problems that could cause you in the future, such as an MI, which is a heart attack, a stroke, or early heart failure. So I was screening you for these cardiovascular problems, and yours was a little bit on the low side, but it was still within normal limits.